Hi, my name is Mackenzie and I'm going to be your nurse today. Closing curtain for patient privacy, washing hands for hand hygiene. Can you go ahead and verify your full name and date of birth for me, please?
Sydney Leland, 2/23/06.
Alright, check your wristband. Sydney Leland, 2/23/06. Alright, great. So today I'm just going to be giving you a head to toe assessment. It's going to take about 15 minutes. Is that okay?
Yep.
Okay, great. And the medical assistant already went ahead and got your vitals. And her vitals are temperature 97.3 Fahrenheit, pulse of 96 beats per minute, blood pressure 120/78, respiratory rate 16 beats per minute, O2 saturation 96% room air. Are you in any pain today?
No.
No, so on a scale of 0 to 10, are you rated at a 0?
Mm-hmm.
All right. Do you have any known allergies?
No.
No? Okay, good. I'm just going to ask you a couple questions really quick. Can you tell me where you are right now?
At home.
And what's today's date?
March 24th to 2021.
And how old are you?
15.
All right. Patient is alert and oriented times 4. Okay. I am going to just inspect and palpate your head now. Check your scalp. No lumps, no lesions, hair is evenly distributed, no dandruff, no lice. Do you have any pain as I'm doing this?
No.
No? Alright, great. Check your face. Face is symmetric. Skin is normal, warm to touch, appropriate for ethnicity. I'm going to check your eyes. Can you look up for me? No abnormal drainage, no redness, conjunctiva is pink, sclera is white. All right, I'm just going to use my pin light now. So you're just going to keep your eyes on my nose and try not to move your head for me and don't move your eyes. All right. Good. Good. Eyes are constricting. This tests cranial nerve 3. Pupils are round, equal, and reactive to light. The medical assistant did your Snellen chart with you earlier, and she said that you have 20/20 vision, so that is great. Can you tell me how many fingers I'm holding up?
4.
One more time.
3.
One more time.
1.
Okay, great. This tests cranial nerve number 2. With my pin light again, keep your head straight and just follow the light with your eyes for me. All right, great. This tested cranial nerve 3, 4, and 6. Next, I'm just going to look into your ears. Have you had any trouble hearing lately?
No.
All right, good. Everything's good. No drainage, no discoloration, anything in there. All right, I'm just going to step back a couple steps and whisper 3 words into your ear. And then when I'm finished, you can repeat them back to me.
Pillow, tree, bark.
Okay, good. This tested cranial nerve 8. I'm going to look inside of your nose now. Just tilt your head up for me. Nose inside is red, normal color. No abnormal drainage or anything. All right, can you open your mouth and say ah for me? Stick out your tongue, move it side to side, and swallow for me. All right, good. This tests the cranial nerve 9, 10, and 12, and they are intact. Can you open and close your jaw for me? All right, good. This tests cranial nerve 5. Smile for me. Puff your cheeks like a blowfish. Okay, great. This was cranial nerve 7. Can you shrink your shoulders up for me? All right, cranial nerve 11 is intact. Next, I'm going to inspect your neck and check your lymph nodes and see if there's any pain and tenderness. All right, lymph nodes. Do you have any pain as I'm doing this?
No.
No? Any tenderness or anything?
No.
Okay. JVD is normal. Trachea is midline. Can you swallow for me one more time? Good. Checking your carotid. Carotid is +2. Carotid is +2. Good. All right, next I'm going to just inspect your chest, listen to your lungs and your heart. Is it okay if I move your shirt around, listen inside of your, in the inside and the back of your shirt?
Yeah.
Okay, thank you. Okay, I'm just gonna listen right here. Take a deep breath in, out, in, out, in, out, in, out, in, out, in, out. All right, lungs are clear. Check in the posterior. Sit up straight. In, out, in, out, in, out, in, out, in, out, in, out. All right, lungs are clear bilaterally. Let me just examine your chest. Chest is symmetric, no discoloration, no scarring or anything. All right, next I'm going to listen to your heart. Listening to aortic, pulmonic, herbs, tricuspid, and mitral. You have a regular rhythm, a normal rate. S1 and S2 are heard. No murmurs or gallops or anything like that, so that's great. Okay, I'm going to inspect your abdomen now, checking all 4 quadrants. Do you have any pain as I'm assessing this?
No.
Palpating?
No.
All right, good. All right, I'm going to listen for your bowel sounds now in your quadrants. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I listened to each quadrant for 1 minute each and for a total of 5 minutes before documenting any abnormal bowel sounds. When was your last bowel movement?
This morning.
This morning? Okay, was there anything, is everything normal, like normal consistency, normal
Yes.
color and all that?
Yeah.
All right, any pain while urinating?
No.
Any abnormal color or smell or anything?
No.
Okay, great. Next, I'm just going to inspect and palpate your arms. Lay those flat for me. All right, do you have any pain as I'm doing this?
No.
All right, great. Warm to touch, normal color, no discoloration. I'm going to check your radial pulse on both wrists. Pulse is strong, +2 bilaterally. Check your brachial pulses. All right, strong and +2 bilaterally. Then next I'm going to check your skin trigger. Recoils immediately. Can you squeeze both fingers for me? Great. Can you push my hands forward? Thank you. And pull my hands back towards you. Okay, good. I'm going to check your capillary refill and your fingernails now. Refill is less than 3 seconds. Can you rotate your hands up and down for me like this? Okay, good. Next, I'm going to inspect your legs. I'm going to feel and palpate them. Do you feel any pain as I'm doing this?
No.
Okay, good. Skin is warm to touch, normal color, no discoloration, no bruises. I notice a scar on the right knee, and we'll be documenting that. And normal hair in lower legs. I'm going to check your feet for any pitting edema. All right, no pitting edema, that's great. I'm going to check your dorsal pedis pulse. Strong, normal, +2. And your posterior tibial pulse, normal, +2. All right, can you push your feet against my hands? Good, and back towards you. Good. And can you point your toes forward and back up? Good. I'm gonna check the capillary refill in your toes. Less than 3 seconds, which is great. Okay, next, can you abduct your legs away from your body? So take your right leg and move it out towards me. Great, back in, left leg, same thing. Good. Can you raise your right leg for me? Good, down. Left leg up. Good. Take your right shin to your left knee and slide it down to your ankle. Good, and same with the other leg. Good. Patient has full range of motion. Next, I'm going to perform the Romberg test. So if you can stand up for me, we're just going to test your balance really quickly. Thank you. Can you close your eyes and take 3 steps forward for me, please? Good. 3 steps back. Good. Do you have any dizziness or out of breath?
No.
Oh, good. Okay. Have a seat for me. All right. Balance. Patient's balance was normal. So that comes to an end of our assessment. Do you have any questions for me?
No.
No? All right, great. So I will be your nurse for the next, the rest of my shift, which will be the next 12 hours. If you have any other questions, you can feel free to ask me. Your call lay is going to be located here on the side of your bed. And hope you have a great rest of your day. Thank you.
Thank you.